hospitals that RCSI was linked to. Some of the major hospitals in Dublin, Beaumont Hospital, Connolly Hospital, and then for paediatrics like Temple Street and Rotunda Hospital for obs gynae. I've actually been lucky enough to be on placements in all those hospitals, and I would say what stands out is in all of them there's RCSI tutors who are doctors working in the hospital, but they're also there to help you anytime you need, and they do provide teachings as you go.
In our first year, we got clinical experience in the form of weekly visits to hospitals, so both Connolly and Beaumont hospitals. And that was just to give us a little taste of different specialties, and we were allowed to scrub in and just observe the teams and how they work.
In June this year, we were placed on our longer placement, so we had 4 weeks of placement. I personally was in Waterford, which was an incredible experience. I got to experience day-to-day life in hospital, seeing how teams run week to week, the different specialties. So we did medicine and surgery. Some of my other colleagues were in Beaumont Hospital as well. Waterford was good fun, and we got to, being with your friends for the whole thing was really nice, and I learned a lot from being on the wards there as well.
My experience on placements and rotations has been my favorite part of RCSI. They are organised by the administration, and the accommodations are sorted for us, so it's a great opportunity to see more of Ireland, to work in a variety of communities of different sizes.
It's a great way to bring knowledge that you're learning in the classroom into the real world and with actual patients. So during the course of the year we do a lot of work with patient actors, and then it's a great transition to start to apply these techniques that we're learning in the classroom on actual patients and in an actual clinical setting. So overall, the placement experience has been very, very exciting, and it's nice to be able to transition, and I would do that for rotations in our 3rd and 4th year.
Now being in my 3rd year of the GEM program, we are able to engage in clinical clerkships or rotations, where we go to different hospitals around Ireland and experience different areas of medicine. I recently just completed my rotation in Obstetrics and Gynaecology, where I was able to help deliver a baby, both a natural birth and a C-section. So it's been absolutely phenomenal, and I have to say it's becoming one of my favorite years.
The paediatrics and obs gynae rotations really do stand out as being phenomenal, very hands-on, really get you involved. You're seeing patients every day, presenting cases to doctors and just helping out. And then, as I said, the kind of level of teaching that happens both in the hospital and back on site here in RCSI through the simulation labs has been amazing, particularly in those 2 placements. The GP rotation then as well was a highlight of 3rd year. You spend 6 weeks solely out in a GP practice, and there you get to talk to patients, perform physical exams, and you kind of work with the GP in terms of managing the patients, and it's a great experience.